talking on clinical research in private practice. Just like this topic, everything, the clinical research comes in last priority of everything. So why I'm going to talk about this is in the last 2 years in my private practice, I published around 50 odd papers. And why should one venture into research is the question. The quest for knowing the unknown is the first thing. Second is understanding a topic at length. That was my insight, like how I started was to understand a single topic at length and not to have a fear of missing out. Everybody shares on Facebook and social media that they have got this publication, that publication, so I should not miss on that. And sometimes you have NMC guidelines that mandates you to have research. So what can you research and publish? Whatever it comes in our mind, whenever it comes, it's like it has to be a new thing. It should not be always a new thing. That's how we are trained during thesis, like you have to find a unique topic, it should not be copied, but it's not like that. Thesis work in PG is only to make you know how the research is done. The real research starts when you start publishing or when you get into the practice. So I'll get into the first thing. This is the most time taking to have an original article on innovative ideas. It takes a lot of time. It takes years of research to do this, but you can do. This is a paper that we had come up. It was, we noticed that in type 3 macular neovascularization, the IRF is last to go, the SRF is first to go. That is completely opposite to the treatment guideline that is prevalent in NMC, where we said that you have to treat IRF and SRF can be tolerated. So that was a flip that we found out, and then we worked throughout the years, 2 years now, and there is still a long follow-up paper that is going to come up with this, but it takes time. If you don't have time, you can do this. You can publish a real-world experience of a new drug. Say a new biosimilar is being launched. You can just do 10 or 15, 20 patient, publish a short case series, and publish that. This is very well, because in Western world, biosimilar is a new concept in ophthalmology. Their readership of our papers on biosimilar real-world experience is very high, and we presented just in URETNA also with that. But if you can't do that, you publish a case report or a case series. Like brolucizumab, when it came out, there was a lot of vasculitis that was happening, and we started publishing case reports on that. So it was to mainly report the unusual presentation of uncommon disease, or it can also be unusual presentation of a common disease or newer treatment paradigm. So we postulated in one of these that what the company is claiming about the pathogenesis of this vasculitis and what actually is happening is quite different, and it is not a type 4 hypersensitivity or a delayed reaction that was there, but it is a type 3 immunogenicity reaction. And ultimately, after 2 years, the company actually bent in and told that it is going to be a 2. And now the new trials of anti-VEGF that you are seeing, there is an entity called as anti-drug antibody that we proposed, and it is going to it is being evaluated in each of these trials. So then there is off-label extrapolated use. So say if something is approved for DME and then you try it for ROP, you can publish that also. If you can't do that, you just write a letter to editor. You are reading a journal, you have got some article and you have some contrary opinion to those, or you're supporting that, you just write a letter to editor. You get a publication, you get a kick, and then you go on to the bigger things. If you can't do that, as Prasanna sir was telling, you can take striking images and go for cover art. These can't be referenced, but you can obviously get published and get the kick of publishing in that. If you can't do that, you can put comments, editorial, and these review articles. These are mostly invited. So you need to have a good publication base and a good rapport with the editorial board to get the invitation. But if you get the invitation, don't refuse that and go into these publications. So it's not like you can't publish. It's only whatever, wherever you are, you just try to do that. You publish a case report, you publish a letter to editor, you publish a cover art, you start publishing, and then when you get the kick, you will see suddenly you are going to do review articles and original articles as well. So one last thing is to avoid predatory journals. They don't have any scientific value. They are potpourri of articles, not peer reviewed. Just to complete the mandated NMC guidelines, we try to go to these predatory journals, but we should avoid these. That is my last thing. And iQuest is our journal from Bihar Ophthalmological Society, where I am associate editor, so you can publish there. That is also there. Thank you for your time.
Thank you, Nilesh, for your presentation. We have Dr. Namrata Sharma, who's a request for some words of wisdom for the YOCs, and we'll get all the YOs for a group photo just after that with ma'am and Dr. Namrata.
Thank you, Digvijay. It's always a pleasure to interact with YOSI. YOSI has been close to us, and I'm happy that YOSI is now standing tall, independent and tall. The testimony of this was the last year's YOSI annual conference, and like YOSI is always very dynamic and very it's a generation which is ahead of us. So I think you've announced your second conference also of the YOSI. You are planning to do it in Delhi?
In Delhi, ma'am, 5th to 7th September 25.
So as it is, I think you are doing great in terms of all the activities which you do smarter than us. But I'm sure YOSI has a long way to go. And next year, I think YOs are going to have a great time because APO has a specific Yo Gala night. And they have a Yo session also. And I will request Dr. Digvijay, Nilesh, Devakant, all of you that you should get the global Yos, the global young ophthalmologists here, because this is your window of opportunity and you can be the global leaders. What AIOS could not be, we could not be the global leaders because American Academy is ahead of us, all said and done, but Yos can do it because our Yos are ahead of all the other Yos in the world.
Thank you so much, ma'am.
So all the best.
With your support and encouragement, we should strive to do that.